Okay, hey YouTube. I don't want to talk about how many times I've tried to make this video, but the point is, hey, this is a top surgery update video. Tomorrow is going to be the 26th of June, and that will be 11 months post-op from top surgery, and I just passed 7 months post-op from my revision. So this is what my chest is looking like. Here, I'll zoom you in. If you follow me on Facebook, Snapchat, Instagram, you have already seen pictures regularly updating. This is what my scars look like. This is only a little bit red right now because I was actually just massaging these little nubbies in the bathroom just now, but you can see that really, I mean, this scar primarily is like gone. Like you have to, I mean, you can see it obviously, but it's really faded. It's making me feel super hopeful that this is going to basically completely disappear eventually. I mean, I'm not even a year out. I've been taking really good care of them. They're really soft. This is getting softer and allowing for more muscle as opposed to like scar tissue. You know, it's a little darker on this side. So for those who don't know, or for a reminder if you did know, I had a minor infection, well, two actually minor infections, one bigger than the other, on this side of my chest, my left side. And so it is like estimated to be a month, like basically up to like 3 months behind the one on the right. I would say maybe it's closer to 2 months now because I've been taking really good care of it, but that's why this is a little bit darker, and also the lighting is not so fabulous where I'm sitting in my apartment, so it looks even darker than it actually is. But they're fading more and more all the time. I'm finally starting to build some like muscle. I can like move them. You may or may not have seen my really nerdy, exciting video of me moving my pec muscles, which is something, it was a boomerang. Something that I always like, I don't know, I always thought it was so weird, and I was like, how do you do this? And then I started to accidentally do it, but now that I really put a lot of effort into the gym again and building my chest, although my eating's not super fabulous, I am getting some gains and like actually seeing kind of definition. There's sort of like a line coming here. It's a slow process, but it's happening. Am I happy with my results? So I had my surgery with Dr. Alexis Hazen at NYU Langone. If you are just catching me right now in the process of my healing, you can go back into my videos, and I have like pretty much everything shown other than the surgery itself. I show my drains getting taken out, my bolsters off my nipples being removed, stitches being taken out. I did a video of my entire day at the hospital and of surgery, and I did videos, I think, of the first 2 weeks of recovery from top surgery, and then I did updates after my revision for, I think, the first week. So there's a lot of information out there and pictures updating you. I did sort of drop the ball for a while just because I didn't feel like there was a lot of change happening and it was kind of repetitive, but now, you know, I'm about to hit a year. That's a big milestone. I'm really excited. It'll be really just so much less stressful once I'm a year, both from my top surgery and from my revision. I'm just looking forward to not having to worry so much about, you know, getting my scars burned and just, you know, building my chest more and more to the chest that I always wanted. I still do kind of have pouches here, but that really has to do with like weight, and these are going away the more and more that I rub them and work my chest. So yeah, Alexis Hazen. I loved her and the whole team. I was just in New York for a wedding, and I was really hoping that I would be able to see her during that time to see if she would maybe inject these with a steroid or something, but I didn't get to go in, so maybe I'll see someone here, or I'll wait until I'm there next, but I don't really know when that's going to be. So, yeah, overall, I'm really happy. I've come a long way. I find myself happier with them all the time. I mean, when I had my first top surgery, these were certainly thinner scars, obviously. With a revision, they basically had to completely cut my scars open again. So they did get a little bit wider. I mean, considering, they were still very thin, and I'm so happy to know that they're gonna disappear, essentially all the same, knock on wood, but I am still using vitamin E cream. I've kind of stopped using silicone strips that I was using. Not that I would, I would absolutely use the tape, but the tape that I was using, the silicone tape, as much as I love it, and I have videos talking about that as well that you can go to back, but it's expensive, and I just can't fit that in my budget right now. But every time I shower, sometimes twice a day, especially on training days, after I work out and before I work out, I make sure to rub these down, and I just pretty much do a circular motion massage all around here, focusing on the nubs, and just kind of like a straight across, and it's made them smooth, and they just keep disappearing. And I tend to, I'm in the sun here now in California all the time, but I kind of resist the urge to take my shirt off outside right now, just because I'd rather wait and have no scars basically visible. Because what I was told when I first got my surgery was, I was asked if there were any other scars that I had had surgery or like stitches for, and I asked because I had 6 stitches here when I was 10. Okay, so since then, obviously, medical technology has also come very far, and you can hardly see this. I mean, no one ever notices that it's there, and honestly, sometimes I forget it's there until I remember how ridiculous and funny the story is as to how I got that, for another day. But I asked if my scars could look like that, and basically she was completely confident that my scars, could be that invisible, and they're on their way. So, yeah, this is it. If you have any questions about Dr. Hazen or my surgery or my care methods or anything like that, feel free to comment below. I always like hearing from you. And if you have a surgery coming up with Hazen or otherwise, it's okay to be anxious. It's okay to be excited. I hope that everything goes well and that you heal smoothly and fast. So, thanks for watching, guys. Until next one.